Hi, my name is Ryan. I'm a student at Nightingale College. Today I'll be performing the task of tracheostomy care on my patient. As always, we want to make sure we have proper patient privacy, closing blinds or doors, introduce ourselves to our patients. We want to make sure our patient is in either high Fowler's or semi-Fowler's position, and we've suctioned if needed. I perform hand hygiene, and I would put on gloves. We've got our sterile kit here. I would open it up away from me, remove our sterile gloves here, take our sterile field, and just touching the outsides of it. We want sunny side down here. I'll take my all the items in this, and I'm going to dump it into the center of sterile field. And I'm going to put this here, and this is going to be our basin for our saline and our 50% saline and hydrogen peroxide. The mix will go in the back here and saline in the front, so I would do that. I would then remove the inner cannula, put that in the mix, and I'm going to remove the old dressing and dispose of that, and make sure or remove oxygen if their patient was being oxygenated. Then I will remove my gloves, perform hand hygiene again, and then I'll put on the sterile gloves. Take my non-dominant hand, grab the inside of the cuff where it's safe, and slide my dominant hand in, and then taking my now sterile hand, I'll grab the cuff here by the thumb. There we go. Almost broke through. We're still sterile. All right, I'm gonna leave this here. I'm gonna have clean hand, dirty hand, but I'll use just the clean end here, kind of separate some things. All right, with my clean hand, I'm going to take the bristle brush and clean the cannula, both inside and around the outside. I want to get any gunk out from inside if there's any gunk there. And then I will dispose of that. And this is going to go back in with the same way I removed it with the curvature of the cannula. Go. I'll take my Q-tips or the cotton tip applicators. I'll put them in the saline. I would have put this in saline also after I had done cleaning it to let it soak for a minute before I put it back in. Now that I've got the cotton tip applicators that are soaking in saline, if there's any gunk around the trach, I would use some of the hydrogen peroxide with the saline to clean, but we're pretty clean right now, so I'm just going to take the saline and clean around the outside, toss, clean, toss, clean, toss, Clean, clean, toss. And the last one. Clean, toss. I would take, again, I haven't crossed my sterile field yet. I would take one of the 4x4s here to dab them dry. And then I will grab the sterile dressing and we're going to reinsert the sterile dressing. At this point, we're not going to have to worry about it being a sterile procedure anymore, necessarily. We're still going to be as clean as we can. We want to support the trach, make sure it's still stable there. All right, that's applied. Next, we're going to remove the tie from the patient and apply our own, and we're going to do that using the one-tie method. So I'll untie this old one, make sure the device is secure. I would have another person come in and put on clean gloves to help me with this. Or have the patient help me because they'll be doing this on their own at home. I want to make sure we're clipped. So we got that. We will dispose of that. Then we'll take our new one. Here's the tricky part I need to be dexterous with. Thread it through the holes in the trach device supplied. Oops, sorry. Bumped your nose. Let's secure it to one side and go around the other. Feed a little bit more line through there. There we go. And we're going to secure it and tie it back to the other side. We'll make sure it's secure but not too tight, and we'll check that in a minute to make sure it's not too tight. And I'm going to tie it with a double knot here on the side of their neck. is double knot. I'm going to take our gauze, that, and have another 4x4 gauze that I would have that's clean, and we're going to put those inside to protect the patient. We don't want any skin breakdown or pressure ulcers or anything. Put on the protecting the skin. Oops, I fell out. And my knot came undone. This will be the part of securing the knot. There we go. And knot is secure. Now we'll protect the patient with the gauze. Do the same with the other side. We'll do 2 fingers to make sure it's not too tight. Got 2 fingers there. 2 fingers there. I'm going to tape the knot, and if our patient needs to be on oxygen, we'll come back up to oxygen at this time. If they need suctioning, we would suction. We would check their vitals. There we go. Taped the knot, covered it. We do it with our supplies. We can do it with our sterile gloves. Perform hand hygiene. Recheck vitals. Make sure our patient is comfortable. The bed is in lowered position. Still in semi-fowlers if that's what they need for breathing. And we would document what we've done. And voila, we perform trach care.